Welcome back. You're watching Beat Diabetes Myths and Facts. The COVID pandemic has affected our lives, our economy, our health, and has spread to every corner of the globe. The rapid spread of new variants offers clues as to how SARS-CoV-2 is adapting and how the pandemic will play out over the next several months. The World Health Organization has said that the highly mutated Omicron variant of COVID-19 could change the course of the pandemic. And due to previous lockdowns and work from home culture, people's lifestyles have already severely been disrupted. Many people have become physically inactive and developed irregular eating patterns, which has led to unhealthier lifestyles and an aggravation of lifestyle-related diseases. A multi-sectoral approach, therefore, is needed to promote healthier diets and increase physical activity, which can also help in slowing down the diabetes epidemic and heart diseases. Beat Diabetes Myths and Facts will impact and help a large number of people to prevent or control metabolic disorders. Today, we have with us a panel of experts to share with you advice on how to lead a healthy life. If you have any questions that you'd like to ask them, you should send them to us on our WhatsApp number 9167666941. That's the number you should send your questions for our experts, and also send us your name and location, and we'll hopefully have those questions answered in subsequent episodes. Joining us on the show today, Dr. Ajit Kumar Sawhney, consultant physician and diabetologist from Bareilly Diabetes Center, is with us. Thanks very much, Doctor. We'll also be joined by our other experts in just a moment from now. But Doctor, if I can begin by asking you, Omicron is spreading at a rate we haven't seen with any of the other previous COVID variants. What can one do to prevent an Omicron infection, and what precautions should people with diabetes especially take at a time like this?
Well, the Omicron variant B.1.159 of COVID-19 is called a variant of concern by WHO based on the facts that it has several mutations which are more than 40 in number and may have impact on how it behaves. There is a substantial uncertainty regarding Omicron, and a lot of research is going on to evaluate the transmission, the severity, and the reinfection risk. The R factor range is very high. It is between 3.5 to 5.5. The presence of new variant is a reminder that COVID-19 pandemic is far from being over. It is therefore essential for the people to get vaccinated, continue to follow existing advice, including physical distancing, wearing mask, regular hand washing, keeping indoors well ventilated, avoid large gathering. Early findings, they suggest that Omicron might be less severe than the Delta variant, but more data is needed. People with diabetes will have to be very cautious and careful against COVID-19 infection. It can take a serious turn in them. They could check blood sugar levels more frequently. They should exercise regularly, follow diet regulation, and be regular with medications. Take all possible measures to keep glycemic levels under control. Thank you.
All right, we also have Dr. B Lakshmi, consultant diabetologist from the Karunya Sughalaya Diabetes Center, Diabetes Care and Research Center, joining us from Kumbakonam in Tamil Nadu. Thanks very much, Doctor, for being with us. My question to you is, what are the treatment options if you get the Omicron infection? Are treatment options same as they were with the earlier variant?
Good evening. Actually, what I want to say is prevention is always better than cure. So try to not to get occur any infection. So maintain social distancing, wear mask, and may proper hand sanitization. Regarding treatment options, if you get any Omicron cases, be calm, don't be panic, be calm, and first, so home isolation is advised. If the patient is having only milder infections and if the SpO2 is more than 95%, home isolation is enough. And regarding treatment for them, we use only paracetamol and other treatments for symptomatic approach only. If the patient is having SpO2 less than 95%, and also for patients having SpO2 more than 95%, and with some comorbid conditions like diabetes, hypertension, or some heart disease or kidney diseases, we decide according to that patient individual condition and other health parameters. So don't be panic. Regarding the treatment difference, actually the scientific evidence shows this wave that Omicron variant is creating only milder symptoms, not like that Delta, which devastated our healthcare system. It creates only mild symptoms like a headache, body pain, mild fever, scratch throat or some sore throats, and nasal congestions. That's it. So symptomatic treatments are enough. The patient is may prone to develop severe cases like patients having comorbid conditions. We ask them to monitor closely, and if the patient is having SpO2 of less than 95%, we try to advise them to get either hospitalized in the wards or in the COVID care centers according to that condition of the patient.
All right, Dr. Sawhney, if I can come back to you at the moment when, just speaking of diabetes, pre-diabetes, if it goes undiagnosed, can lead to development of type 2 diabetes. How is pre-diabetes defined, and should it be considered as a warning sign for people to take steps to prevent type 2 diabetes? How can type 2 diabetes or pre-diabetes be treated and controlled?
Yeah, that's true. A condition which is characterized by elevated blood sugar levels, but not in the defined diabetic range, is a pre-diabetic condition. It is possible that the person in future may get converted into type 2 diabetes if proper precautions are not taken. Exact number of diabetics in the world are not estimated, as they may vary from region to region. There are nearly 20 to 54% pre-diabetic in the age range of 20 to 79 years. Of these, 25% will get converted into type 2 diabetes in 3 to 5 years. About 70% of these will develop diabetes in their lifespan. Now, how do we diagnose? If the fasting blood sugar is between 100 milligrams to 125 milligrams, or postprandial blood sugar is between 140 milligrams to 199 milligram, or HbA1c is between 5.7% to 6.4%. If any one of these conditions is met, then the diagnosis of pre-diabetes is made. Yes, it can be reversed with strict lifestyle measures like regular exercise, proper diet control, weight loss, regular walking, and If it is not through that, then with the addition of metformin, yes. Apart from that, a strict control over smoking and moderation of alcohol is required. Thank you.
Right. Well, we also have Dr. Renuka Prasad joining us, Managing Director and Diabetes Consultant from the new Diacare Center in Mysore. Thanks very much, Doctor, for being with us. What is the treatment, Dr. Prasad, if I can ask you, what is the treatment approach for newly detected type 2 diabetes patients, and are there specific guidelines in place for these patients? And are these different for people who've been detected with diabetes post a COVID-19 infection?
Of course, when the person is treating with diabetes, definitely we do have a lot of protocols, for even from American guidelines, European guidelines, like our own RSST guidelines. When a person is detected as a diabetes, newly detected diabetes, we do go through normally what we do. Generally, we give the trial period of diet, exercise, and a healthy lifestyle. After the trial, it also based on their HbA1c, blood sugar level, overall profile, and even the comorbidity as well. Based on all these profile, we are going to treat them. Initially, if the HbA1c level is less or less than almost less than at least 7, 8, then we will go through the lifestyle modification and also healthy diet. If it is more than that, we will start with the pharmacotherapy. And later on, we can up titrate or down titrate according to the response. But when a person detected has a diabetes during the COVID-19 infection, especially it happens when the people who are not been exercising regularly are having a strong family history and having a very bad health lifestyle. In such cases, it can happen. They may actually, even the COVID-19, it spurts the further risk, and that person will become diabetes. During that time, we can't actually proper the regular guidelines like diet and healthy lifestyle. But during that time, we keep monitoring the blood sugar. And of course, when the severity of the infection is more, we have to go with the insulin. Insulin is the one medicine you can use at any time, even during the illness, even after the illness as well. So considering that point, definitely when the person is treated for COVID-19 and that further complicate the things, if the sugar is on higher side, we need to monitor regularly, and also we put them on insulin. And once the severity of the infection has come down, later on we'll add on some oral tablet as well. And we always advise them to monitor strictly even after the discharge. Even in case of the pregnancy and type 1, that also where insulin is playing an important role. So as I said, the insulin is the best therapy to start with even during the COVID or during any illness.
Right. Dr. Lakshmi, the measurement of vital signs is an important part of a clinical workup. Looking at the increasing prevalence of new onset of diabetes, should blood glucose be tested in all patients who are hospitalized, and should it be considered as a fifth vital sign now?
Yes, it should be considered as the fifth vital sign because of that COVID pandemic and the lockdowns, many are having work from home options and the physical activities significantly reduced. If they go to at least office, they will have the chance to climb the stairs or at least to walk in that office, something else. But staying in the home, the more patients are developing metabolic disorders because of abnormal eating habits and decreased physical activities. So if we get any patients hospitalized, whatever may be the reason for admission or hospitalization, blood sugar must be checked, and it may be good considered as a fifth vital sign. And moreover, after COVID second wave, we are getting, there is a spurt of spurt of type 2 diabetic patients, more number of new type 2 diabetic patients, and and already known diabetic patients or having very less control because of abnormal lifestyle conditions. So blood sugar level shaking must be considered as fifth vital sign. It is the need of the heart. Thank you.
All right, well, important points being made there. We'll continue this conversation with our expert doctors on the other side of a short break. Stay with us. Welcome back. You're watching Beat Diabetes Myths and Facts. We have a panel of expert doctors who is live with us at the moment. Dr. Sawhney, if I can come to you. Speaking of diabetes, it affects almost every organ of the body. Do these diabetic complications start showing up immediately after you've been detected with diabetes, or is there a gestation time period?
Well, these complications, they do not appear immediately. It takes around 10 years for them to develop. And these complications, they could be in the eyes, there could be a cataract, there could be a problem with the vitreous chamber, and then there could be a problem with the retina. That is diabetic retinopathy. Then we have problems with the nerves. There may be pin and needle sensation, paresthesias in the hand and feet. Then there may be stomach upset. Yes, it could be constipation, diarrhea, gaseous distensions, and it could be GERD, that is the reflux disorder. And then we can have problems with males, especially it is erectile impotence. These are, and then we can have the problems with the kidneys. Further, there could be strokes. There could be problems with the heart attacks, MI, angina, and then there could be a problem with the cardiac muscles, which is known as cardiomyopathy, and then rhythm abnormalities. There could be problem with the peripheral artery, and person may have a diabetic foot, which is very dreadful complication of diabetes. Infections, we are all aware of, we all have heard of in the second wave of mucormycosis. Then there is a problem with the brain. We can have Alzheimer's disease, etc. with that. These are all long-term complications of diabetes. Thank you.
All right, Dr. Prasad, can early short-term insulin treatment in people who've recently been detected with diabetes help reverse type 2 diabetes?
Yes, regarding the diabetes reversal, now instead of saying the reversal, I would like to say remission, because we don't know how long they can be without medication. So in that way, remission is the correct word to say that. Definitely the short term of insulin definitely has a role in reversing all the metabolic changes which could have happened due to hyperglycemia. So not only that, when it comes to the remission, always we have to consider the few more points, like the duration of diabetes should be lower, and if obese, if there is a scope to reduce the weight, and the carbohydrate intake has to be cut down, and their mental and physical fitness should be maintained well, and if the body insulin level, if reserved, like we could actually able to check that through the simple test called C-peptide. If that shows the insulin, well reserved insulin, then definitely it is possible, even for a short period of insulin therapy, definitely it will try to reverse or even give a small remission for a period. But it is possible only in the selective patient, and they should also follow this for a longer time. But most of the time the people thought the remission of diabetes is end of the story. No, you may get the freedom from diabetes at that moment, but it is not the freedom from follow from your doctors. So the person who have been actually treated for the diabetes with the medication, once that have been waived off through their lifestyle and diet, but they should always be in touch with their doctor for the further follow-up and to avoid the further aggravation of diabetes status.
All right. Well, Dr. Lakshmi, is there any correlation between a baby's birth weight and the possibility of developing type 2 diabetes? What are the kind of precautions that pregnant women need to take to avoid this?
Really a good question. Both low birth weight or small for date babies and large birth weight or large for date babies both pose greater risk of developing diabetes and other metabolic disorders in future. Actually, maternal environment, that is that in utero environment, gives a good environment which creates or the future of that baby. The health condition of the baby depends on the maternal environment mostly. Awareness is necessary because pregnant women who takes good nutritious food can get a good normal weight babies. Low birth weight babies are possible if the women takes poor nutrition and if the other metabolic disorders metabolic signs should be under good control during the time of pregnancy. That is, blood sugar should be maintained under good control, and hypertension is also, that is, blood pressure should be maintained under good control. And women has to take a good nutritious locally available healthy foods which can help the baby to live healthy in the future. In the opposite side, high birth weight babies are being prone to born to mothers who are exposed to high blood sugar levels during their gestation or pregnancy. So, and also who eat junk foods or eat excess of food also may get large babies. So it is paramount important to take good nutritious locally available healthy foods during the time of pregnancy, and the women has to maintain normal blood sugar levels and blood pressure levels under normal conditions.
Right, doctors, thank you very much for your time. That's all the time we have on the show. We're slipping into a short break. We'll bring you more news on the other side. Stay with us.